Hello, and thank you for watching. I'm Pat Borgen. I'm the chairman of surgery and the chief of the Breast Cancer Center at Maimonides Medical Center in Brooklyn, New York. I'm also chairman of the Miami Breast Conference. I'm very pleased to be today with the incredibly beautiful, talented, inspiring Sandra Lee, who will be our keynote speaker at the 34th annual Miami Breast Conference. And we're going to be talking a little bit about Sandra's diagnosis. The Miami Breast Conference is the oldest, longest running, and the largest clinical breast cancer congress in the world. Our audience, which is made up of over 1,000 doctors, treats about 25% of the breast cancer in America on a yearly basis. We talk a lot about patients learning from their doctors. We don't talk enough about doctors learning from their patients, and that's what we're going to do today, and it's what we're going to do with you in Miami. So welcome, and thank you for joining us in Miami and for sharing your story with our audience.
And I want to take just a moment before we begin and thank everybody. Thank you, and thank everybody for all the hard work that you do on behalf of your patients.
Thank you.
Because you save lives.
Thank you. Let's jump into your story. There's been so much controversy about mammography, daily, monthly, yearly. Your DCIS was discovered on a screening mammogram. You had no symptoms, you had no lumps. Tell us a little bit about that.
It was just an ordinary Monday, a beautiful Monday, and I was up for my annual mammogram, which I actually thought about canceling because I was so busy that day. And then I went in and I got my mammogram, and it just took a lot longer than it normally takes. And one side they just kept doing over and over and over again. And I got frustrated and walked into the radiologist's office and said, "What's going on?" And she shared with me that she saw what she thought might be an issue in 3 separate individual places, and none of them were connected. And she just wanted to make sure that what she was seeing was accurate. So she was trying to look at it from all different sides.
Did she say these were microcalcifications? These were little calcium dots? Is that what she saw? So it was 10, 12, and 2 in one of the breasts. And what did she recommend at that point?
At that point, she said, "But I don't know what it is. So you need to speak to a doctor, and they need to advise you of what you should be thinking about and or doing. They're probably going to recommend a biopsy. If it were my breast, I would be getting a biopsy." And I said, "If it was your breast, what kind would you be getting?" And she said, after she explained to me that there was a needle and also a surgical, she said, "I would probably do a surgical only because I just would want to know for sure. And sometimes cancer can hide behind things." She goes, "But I'm not a doctor. You need to talk to the doctor." And so I did. And on Wednesday, I had my surgical biopsy.
Now, did they biopsy 1, 2, or 3 of the abnormal areas in the breast?
I think they did all 3.
Okay.
And then I got a call on Friday at the end of the day, after a big day of production, and my doctor apologized that he was telling me this on the phone, but that it came back, and I had a very early stage breast cancer.
And all 3 areas,
In all 3 areas.
were DCIS.
All 3, and none of them connected. You know, there's highways in there. That's how they explained it to me. They were all isolated individual occurrences on their own.
Right. Going into this, did you have any family history of breast cancer? Anyone ever have any breast problems in the family? No?
No, we've had issues with, uterine issues. I'm not sure it was cancer. And that person isn't around anymore for me to ask. Ovarian issues, but never breast.
Right.
So I was always really diligent about making sure that I got into my appointments, whether it was my pap smear or it was my mammogram. Always, always, always.
So looking back on this, the doctor was being very considerate to contact you on Friday, so you didn't have to worry all weekend. But I know we hate to break news over the phone. How did you feel about that, and how do you feel about that now, looking back on it?
Grateful. I'm the kind of person that wants to know. I'm also the kind of person that I don't need a lot of drama and solace in a moment that I'm just trying to digest something. But it depends on the person that you're dealing with. And I was grateful
That's
that he
great.
told me. And he called me over the weekend.
Right.
It's really hard, I think, for doctors because you go through it every single day and you diagnose it and or don't, or cure it and or don't every
Yeah.
day.
Yeah.
And it's hard to know when to make the right decision on how and when to tell someone based on what you get back.
Right. Sure.
But what's really important is that you stay connected, and he
Right.
stayed connected with me through the weekend.
One of the reasons that the Miami Breast Conference is so important is that breast cancer is not a single disease. In fact, it's a vast, complicated family of diseases. And that's true of DCIS also. So my question is who was your source of information about what DCIS meant and what the options were? I assume you went and saw a surgeon, right? Was that person your key point of information as far as what DCIS means and what it doesn't mean? Tell me a little bit about that.
At that time, that doctor was my contact for information, and also my partner's and my sister's contact. He was very generous. I didn't ultimately wind up going with him because I'm a little aggressive thing, and I wanted a really aggressive doctor, and I didn't feel like he was aggressive enough for me. And I love him to this day, I do. But I think that it's really important that the doctor mirror the patient's personality type. And also the doctor is kind of the power source because you're giving up your life in a sense, your confidence, all of your trust has to go at the same time into one person or a team of people. And that is a very tender, huge responsibility that needs to be dealt with thoughtfully. And some doctors can be very matter of fact and in and out, and they don't, and doctors aren't supposed to have that emotional connection. But the patient needs to know that the doctor, as tough as the doctor is,
Right.
takes a moment and says, I get it,
Right.
I got you.
Right.
Healthy and beautiful.
Right.
Let's get you to healthy and beautiful.
Right.
That is all.
Right.
And every
Right.
day of life is beautiful, no
Right.
matter who you are or what the outcome is. Some people want to have reconstruction, some people don't, some people can't, some people lose their nipples, some people have new ones put on. It doesn't, whatever it is, doesn't
Right.
matter.
Right.
The only thing that matters is that you are here for as long as we can keep you here, period.
Right.
And that's what I looked for,
Yeah.
and that's what I got.
So one of the things that has increased in this country is this bilateral mastectomy option, and removing not only the risk on one side but removing the risk on the other. And I think that America has often been criticized by our European colleagues for doing too many mastectomies, and I of course reject that. The right answer is what's right for the woman. And so you got a second opinion, and you found
And a third opinion.
And a third opinion. Tell me a little about that. How different were the three opinions?
I was in a very well-known hospital where the surgeon came in and told me I had breast cancer again, which I already knew after looking at my files, and laid out for me a course. Her boss walked in without her in the room and sat down and told me I didn't have cancer at all and that I should just wait and see. I was so shocked by how different in the same hospital the two doctors not only described to me what I had, but described to me how I should handle what I had.
So that's amazing. Just
extremely confusing.
think about that for a moment. The same hospital, same exam room, two different doctors, and two completely different opinions. How did that make you feel?
Confused.
Yeah, sure.
And after I'd seen two other well-known doctors, and I saw this third well-known doctor, to then have her boss come in and say, DCIS is not cancer. By the time my surgeon got in, she said that it was all over. It wasn't just at 10, noon, and 2. It was all over. I don't understand how responsible human beings, doctors, can have a wait-and-see attitude. Based on the patient, of course. I'm not a doctor. I got that. Knowing that the diagnosis is coming earlier and earlier.
Right.
Women in their 20s and their 30s, it's an epidemic.
Right.
To not be or not advised to be
Right.
as assertive as possible with a disease that everybody is still trying to figure out. To me, a doctor's job is not to practice on your patients. They call it a practice, but I don't want to be practiced on.
Right.
Do you want your daughter practiced on?
No, of course
Or would my surgeon ultimately want her husband practiced on?
not. Right.
Because breast cancer affects men too, men
Of
and
course it
women.
does. Now, so I saw you speak at Cipriani's in October for the Komen Foundation. I'm their medical director. And I was completely blown away by you and your energy and your candor. You mentioned something about complications that you suffered, and you might have even been having surgery that day or the next day.
The next day.
Right. So can you talk a little bit about what happened after the surgery and what has happened since then?
Well, you know better than anyone how absolutely brutal this surgery is.
Absolutely.
It is a brutal
Yep.
surgery.
Yep.
And there is no one on the planet, no human being on the planet is prepared for what your body goes through during that operation. And there's no way to describe it. So it is, you know, you're burned and you have necrotic skin. A lot of women have this, and I'm very thin-skinned. On the exterior.
Yeah.
No, I'm very
You don't strike me
thin-skinned.
as a
I am.
thin-skinned kind of.
I am very thin-skinned. And it really affected me on both sides. Really affected me. It's a savage surgery. I almost completely lost my right side. To the doctors and the nurses, I would say, whatever you have to do to save as much breast tissue is what you have to do on the external for any woman or man. But there were, you know, after a few days, they started bringing in this topical that opened up all my capillaries. I mean, it made me feel like my head was going to explode off my body.
Wow.
But it brought that blood flow back, which is
Yeah.
what I needed.
Right.
One of the things that was not made clear to me, which I wish had been clear to me, I'm not sure I would have changed my decision, probably not, but that when you have a surgical biopsy, it cuts the blood flow. Because if you go back then and have a mastectomy, that blood flow is cut. And then you're cutting from behind. So
Right.
the source of the blood flow is not what really it needs to be to heal properly. And that's difficult.
Right.
So I knew that I was not going to go back in and have them hack up my side, hack up my back to rebuild my front. I just wasn't going to do that.
So they talked about a tram flap, which is the tummy tuck, or a latissimus flap, which is the back, and you decided that was not. More incisions, more scar, more pain, more surgery was not for you.
No, not for me. And I said, I will sit here and I will heal. I don't care if I go into an oxygen chamber. I don't care what topical you give me. I don't care if I sit home for the next 6 months. I don't care if I have scar tissue. I don't care. I'm not doing that. So you can take them all off now, which I prefer we don't do, or you can let me heal and see how far I got. So my original surgery was May 19th, and in August I finally got an infection, which I think I did pretty darn good.
That's pretty good.
Sitting there with almost
That's
an
pretty
entire
good.
breast of necrotic skin.
Right.
That, and I've never actually talked to anybody about that or even said those words out loud. I'm surprised I did it so easily, but it is what it is.
So looking back on the whole experience, Tell me about if any of the doctors that you saw or who took care of you were standing with us in this beautiful room today, what would you say to them? What message would you give them?
I would thank all of them, each and every one, for what they do and what they tried to do. They all, even the ones I interviewed and didn't go to, they all did their best to provide me with as much information as they could. And each doctor added something different than the others. I would thank them. The one who said I didn't have breast cancer and I should wait and see, I would say shame on you. But at the end of the day, I would hug each one of them and am most grateful for all of their time and energy.
Sandra, in March, you'll be in the grand ballroom of the beautiful historic Fontainebleau Hotel with 1,000 experts in the field of breast cancer. What's your take-home message? What's the most important thing that they can learn from your journey?
You really need to listen to your patient and be patient with your patients. We don't want to feel like you're practicing on us. We want to feel like you understand us and that it's personal and that we're your only patient in the world. Even though we know you have 100 other, we need to feel like we're the most important one. And every time you walk into that room, you are on. You are the star in that room. And that one person looks at you like the only thing between you and God, the only thing between them, that person in that room, the only thing between them and God is you. And as much as they want to see God, they don't want to see God yet today. So your job is to save their lives, make them feel better, give them hope, give them your understanding, and reassure them. And make sure that they have somewhere to call if you're not available, so that when they have those questions, they can get them answered, that they have the support groups that they need, and that their families also understand what their diagnosis is, what they're looking at, and how they can help facilitate and insulate.
So Sandra, I've been in this business for 25 years in the fight against breast cancer. And I want you to know that you're one of the most inspiring, articulate patients I've ever seen. And I really look forward to seeing you in Miami.
Thank you. We're going to have a very, very good conference.
Thank you so much. So I want to thank Sandra Lee for joining us in Miami for the 34th annual Miami Breast Cancer Conference. It is really a pleasure and a privilege to have a patient who has so much to teach us about her own personal odyssey and what lessons we as physicians can take home from that.